Everybody, today we're going to be talking about aromatherapy. So, what is aromatherapy? It is also known as being called essential oil therapy because it uses essential oils. Essential oils come from seeds, stems, leaves, needles, petals, flowers, rinds, fruits, woods, resins, roots, rhizomes, and grasses. And how essential oils are made is the oil is extracted from the plant by distillation, by steam, or mechanical cold press. Aromatherapy is now thought of as an art and science because it gained recognition in the fields of science and medicine. It is a holistic healing treatment that uses plant extracts to promote health and well-being. So it improves the body, mind, and spirit. How does aromatherapy work? It works through the sense of smell and skin absorption. The essential oils can be used internally, topically, or aromatically. You can use essential oils alone or you can combine them. It really just depends on your desired therapeutic effect. Essential oils can be used as diffusers, aromatic spritzers, inhalers, bathing salts, body oils, creams, or lotions as like a massage, facial steamers, hot and cold compresses, and clay masks. So a lot of essential oils are available in your regular stores. There are hundreds of essential oils, but the most popular ones are going to be your clary sage, cypress, eucalyptus, fennel, geranium, ginger, helichrysum, lavender, lemon, lemongrass, mandarin, neroli, patchouli, peppermint, Roman chamomile, rose, rosemary, tea tree, vetiver, ylang ylang. So the benefits of aromatherapy is that it can manage pain, it can improve sleep quality, it can reduce stress and anxiety. It is said that it soothes sore joints, it treats headaches and migraines, it alleviates side effects of chemotherapy, it can ease discomforts of labor, it fights bacteria, virus, or fungus like your cold and your flus, it improves digestion, it can improve hospice and palliative care, and it can boost immunity. Why is aromatherapy supported, and what is the desired outcome? So back in the day, in the Western medicine, opioids and anti-anxiety medications were extremely abused. So the federal government stepped in, passing laws, monitoring prescriptions written for opioids. Therefore, a search for alternative medicine began. Alternative methods were founded in the Eastern perspective on healthcare. So Westerners found many alternative methods to treat medical conditions such as pain, anxiety, depression, insomnia, with the help of scented oils from plant sources. So this would be your essential oils, aromatherapy. So the pendulum began to swing from the Western medicine to the Eastern holistic approach, and aromatherapy essentially emerged and was embraced as their alternative medicine for medical conditions. Pathophysiological response to healthcare aromatherapy. When essential oil and aromatherapy is inhaled, molecules activate the olfactory, respiratory, gastrointestinal, and integumentary systems based on the pathway of activation. Then the molecules are capable of releasing endorphins, which makes you really happy. Two common pathways triggering pathophysiological response to aromatherapy molecules, and the most common way to use aromatherapy is by inhalation through a diffuser. Doing this would activate your olfactory, and this enhances your parameters for blood pressure, pulse rate, muscle tension, pupil dilation, body temperature, and blood flow. So inhalation through a diffuser essentially travels through your nostrils to the olfactory bulb, and then travels to the brain for processing, and then triggers an emotional response, activates thoughts and feelings. It travels through the upper respiratory tract to the lower respiratory tract, and then to your blood vessels, to the bloodstream, and then to your organs and tissues around your whole body. And essentially, this is affecting your mind, body, and spirit. The second common pathway for aromatherapy is through the skin, such as by massage. And this will help your molecules get absorbed. Again, it travels through the upper respiratory tract, and then through the lower respiratory tract, and then through the blood vessel to the bloodstream, and then to your organs and tissues all around your body. The skin pathway absorption of essential oils can reduce a patient's perceived stress, enhancing healing and increase communication. Aromatherapy clinical management. Aromatic scents and oils used in clinical aromatherapy can be extremely beneficial for symptom management, such as pain, nausea, vomiting, anxiety, depression, stress, insomnia, agitation with dementia, cancer, pain, and end-of-life symptoms. It has been found that it is extremely beneficial in inpatient and outpatient settings, especially critical care, oncology, palliative care, hospice, and surgical. When it is ordered by a provider or a physician for symptom management, an RN must perform a history assessment, obtain the patient's vital signs, identify symptoms, and educate the patient on essential oils, measure the symptom management, evaluate the effectiveness, and document the plan of care, just making sure that the patient is aware of what aromatherapy can do for them and the side effects and all that. So a journal article that I found was in a hospital setting dealing with the nurses and then the patients. So the study examined the impact of aromatherapy on the nursing staff, their stress level and anxiety in a palliative care environment where nurses care for patients with serious life-threatening diseases and difficult to manage symptoms. And then afterwards, the study explored the impact that the nursing staff stress might have on the patient's stress as well. So what they did was 4 weeks before the essential oil diffusion started, there was 28 nurses, and they had completed an electronic stress and mood questionnaire. And then afterwards, the essential oil was continuously diffused throughout the nursing stations for 4 whole weeks, like throughout the hallways and everything. And then afterwards, at the end of the 4 weeks, another electronic post-intervention questionnaire was done. And then the results had shown that there was an increase in positive mood, there was a decrease in stress, and an improvement in feeling, as the nurses would say, more grounded. As I said before, the study wanted to determine the patient's stress level based off of the nurses' moods. And so when they did that, they collected the patient's data from the EHR, and they were evaluated for 3 months before, during, and after the intervention. And the study had found significantly less blood pressure variability during and after the intervention. So overall, the aromatherapy diffusion worked to lower the overall stress in the nurse's work area, and then showed a positive effect on the stress of their patients. So these results have led to excitement about the power and potential of essential oils in patient care settings. And essential oils are very cheap, like they're very easy to obtain. So this would be a very beneficial product for anyone who is in need or looking for a different approach at things. And these are my sources used. Okay, thank you very much for listening.